Hi there. Today we're diving into an essential topic for every healthcare professional: medication orders. What are they? Why do they matter? And how can we make sure we're reading them correctly? Let's get into it. A medication order is written instructions from the healthcare provider for administering medications to patients in the hospital. Every medication order has four important parts. First, the name of the medication. Second, the dosage. Third, the route. Fourth, the frequency. Simple, right? But every detail matters because lives depend on it. Let's break down the four key components of a medication order so you can ensure safety and accuracy. Component 1, name of the medication. The medication can be written in its generic name or brand name. The generic name is preferred because it allows the medication to be substituted with brand name drugs. The medication should be written out and spelled correctly. In this example, the medication's name is furosemide. This is the generic name. The medication is also known by its brand name of Lasix. Always double check the spelling. Some medications look and sound alike. Component 2, the dosage. The dosage indicates the amount of drug to be administered. In this example, the dosage is 20 milligrams. That tells you exactly how much of the drug to administer. Giving too much or too little can be dangerous, so accuracy is critical. The dose can be written in different formats. For example, the dose of the drug can be indicated by its weight, written in milligrams, by its volume, written in milliliters, the number of the drug form, such as one tablet, by other quantities, such as one puff when dosing an inhaled metered dose medication, in standard units, such as 10 units of insulin, or by drops when prescribing liquid medications for the ears and eyes. Component 3, the route. The route describes how the drug should be administered. In this example, furosemide is to be administered orally, which is abbreviated as PO. The route affects how much and how fast a medication is absorbed. Some common routes include PO, by mouth, orally, sublingual, under the tongue, subcutaneous, in the subcutaneous tissue, intramuscular, IM, into the muscle, intravenous, IV, into the vein, transdermal, on the skin via a patch, rectally, per rectum, inhalation via the lungs, enteral, NG tube or a G tube into the GI tract. Want to learn more about abbreviations you should and shouldn't use in medication orders? Check out our next video at nursevideohub.com. Component number 4, the frequency. Finally, we have the frequency, how often the medication should be given. Medications must be administered at designated times to ensure a dosage that promotes therapeutic effects and minimizes any side effects. Routine meds are medications taken on a regular basis. The frequency of routine medications can be specified in terms of how many times a day, such as once daily, BID twice a day, TID 3 times a day, QID 4 times a day. The frequency may be specified in terms of how often it occurs during the day, such as every 6 hours. You'll also see special timing instructions like AC, before meals, PC, after meals, HS, at bedtime. Then we have PRN orders, which means as needed. The drug is only administered as needed, not routinely. PRN orders are written in advance to allow the nurse to administer medications under specific circumstances. For example, acetaminophen, 350 milligrams PO every 6 hours, PRN pain. You'll only give it if the patient is experiencing pain, and not more than every 6 hours. Let's quickly cover a few more types of frequencies of medications orders that you may encounter. One-time orders. Potassium chloride, 20 milliequivalents PO once. As the order states, it is only administered once. Stat orders. Epinephrine, 0.3 milligrams, IM stat. This is an order to be given immediately. For example, for someone experiencing an anaphylactic reaction. Titration order. A titration order is when the nurse adjusts the dosage of a medication up or down based on specific patient parameters, such as their blood pressure or a lab value, to achieve a desired effect. The order includes a starting dose, and then the incremental unit the dose can be increased or decreased. It includes the frequency for increasing and decreasing the dose, and the maximum rate of infusion. For example here, when administering this dopamine drip, you would titrate it to keep the patient's systolic blood pressure greater than 110. You start the infusion at 5 micrograms per kilogram of the patient's weight per minute. You can increase the dose by 5 micrograms per kilogram of the patient's weight per minute every 15 minutes. And the maximum dose is 20 micrograms per kilogram of the patient's weight per minute. Standing orders. You may run across standing orders. A standing order is written in advance and allows the nurse to administer a medication under specific circumstances. These are written ahead of time, like this hypoglycemic protocol for diabetic patients. If a patient's blood sugar drops below 70 and they have an IV, you may give dextrose 50% IV push per the protocol. So remember, every medication order must have 4 components: the medication name, the dosage, the route, and the frequency. If anything is unclear, don't guess. Call the provider and clarify. Patient safety always comes first. Thanks for watching. If this video was helpful, give it a like, share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more tutorials and resources at nursevideohub.com. Watch, learn, and care.